Fatty liver is not always from alcohol, and this confusion can delay treatment. Alcohol fatty liver usually happens when liver is repeatedly exposed to alcohol, causing fat buildup, inflammation, and eventually scarring. And I'm going to talk about the differences between fatty liver from alcohol and non-alcoholic type. Non-alcoholic fatty liver is called MASLD, usually linked to insulin resistance, belly fat, diabetes, high triglyceride, obesity, and sugary drinks. Here's the real difference, and I think very important to know the difference. A person with alcoholic fatty liver may have a history of regular alcohol use, fatigue, poor appetite, abnormal liver enzymes, and sometimes signs of alcohol related damage. A person with non alcoholic fatty liver, they may say something like, Doctor, I don't drink at all, but they may have prediabetes, weight gain, soda intake, high cholesterol, or belly fat. Clinically, both can look silent for years. Many patients have no symptoms until liver inflammation, fibrosis, or cirrhosis develop. So the liver does not care whether the injury is coming from alcohol, sugar, insulin resistance, or processed food. Chronic damage can still lead to cirrhosis. So checking your liver enzymes, A1C, triglyceride, and consider getting liver ultrasound or fibroscan. That's very important. Now, I'm going to talk about the chronicity of two different types of fatty liver and eventual complication of cirrhosis. Both can silently progress for years and end in the same serious complication, but the speed and pattern differ. Alcoholic fatty liver disease called AFLD, what is the timeline? Weeks to months. Fatty liver develops within weeks to months, but it's reversible if person stops drinking. Now, it takes months to years to develop alcoholic hepatitis. Repeated damage, repeated exposure to alcohol leads to inflammation and can be severe. Usually is indicated by elevation of liver enzymes. Now, fibrosis to cirrhosis can take 5 to 10 years. And then after that, liver failure and cancer. So there's a faster progression. There's episodic worsening, the binging leading to acute hepatitis. Symptoms appear earlier. You have jaundice, abnormal swelling called ascites, and confusion, hepatic encephalopathy. So because alcohol acts as a direct toxin and damage accumulates rapidly. Now, on the other hand, MASLD, a non-alcoholic fatty liver, timeline is different. And I'm saying this timeline is based on if lifestyle is not changed. It takes about 5 to 15 years to develop simple fatty liver. It's silent. There's no symptoms. And it takes 10 to 20 years to develop non-alcoholic steatohepatitis, NASH. That's when the inflammation begins. And it takes decades, leads to fibrosis and cirrhosis. So you can see, and that can lead to liver cancer. You can see the progression is slower, much slower, and silent. And often symptoms are not there until late. Now, there's a strong association with diabetes, obesity, and high triglyceride and metabolic syndrome. Key point is damage is indirect, driven by insulin resistance and chronic inflammation. Now, outcome is same. It develops fibrosis, cirrhosis, liver failure, and liver cancer. End stage is the same. The liver doesn't care about the cause. So, practical takeaways: alcoholic fatty liver, faster damage, earlier symptoms. Non-alcoholic fatty liver, slower but silent, often missed. If there is no lifestyle changes, inevitable progression risk in both cases. So by the time symptoms show up, liver is already significantly damaged. So window for reversal is early. So thank you for watching. Have a great Monday.